And topping our news this half hour, millions of people face a health care crisis. They're unable to pay for doctors and struggling to buy their prescription drugs. But now a local program that provides access to care has become a model for the nation and hopefully will help scores of people get the medical attention they need. News 13's Susan Mundy joins us with more this morning. So Susan, this is so critical for so many people.
It sure is, Kathy. Far too many folks do not have access to good health care, and that's where Project Access comes in. Alan McKenzie is the CEO of the Buncombe County Medical Society. Thanks for being with us early this morning.
Oh, good. Looking forward to our conversation.
And the Medical Society runs Project Access.
It does.
Explain to folks, what is Project Access?
Well, the Buncombe County Medical Society is the voluntary professional association of the physicians in Asheville and Buncombe County. Project Access is a coordinated charity care system providing access to the full continuum of care. This is physician services, medications, hospital services for free. And in a coordinated fashion.
Well, we're seeing some awards there. You all have gotten a lot of awards for your work, and now it's become a nationwide model. Explain that to us.
It sure has. There are now over 24 communities across the United States, ranging in size from under 20,000 up to almost 2 million, that have taken the Project Access concept and adapted it to their communities and are able to provide access to care for their low-income uninsured.
Actually starting the American Project Access Network, talking about this going nationwide.
Right. The American Project Access Network is an organization we're pulling together here in Asheville with the help of nationwide experts, the Bureau of Primary Health Care, the Assistant Surgeon General, the United Way of America. All of us are going to come together to provide technical assistance to communities that are hoping to replicate Project Access.
So it's really providing pharmaceutical drugs, health care, and also even hospital care.
Absolutely. In the last 12 months, we've seen about 17,000 low-income uninsured patients at least once. Our studies indicate that there are about 20,000 low-income uninsured people in Buncombe County, so we're providing universal access to virtually every low-income uninsured patient in this community.
So important. Well, thanks for being with us this morning, Alan. And coming up in our next half hour, we're going to talk a little bit more with him about how people who need this care can contact Project Access and get the help they need.
Thank you.
Kathy?
A local program that offers health care to those who can't afford it is now a model for the nation. And some say Project Access is the answer to the health care crisis facing our country. News 13's Susan Mundy joins us now live with details. Susan.
Kathy, Project Access has been up and running for several years now in Buncombe County, and it's quite a success. Alan McKenzie is the CEO of the Buncombe County Medical Society, which runs this program. Thanks for being with us, Alan, and tell us, how does it work?
Well, the physicians of Buncombe County have all committed to providing access to care for the low-income uninsured and providing free care to those who can't afford insurance or to pay for their care.
Where does the funding for this then come from?
The funding for local Project Access comes from Buncombe County commissioners. They fund the cost of medications for the patients that the doctors are seeing for free in their practices. And we are forming a national organization now to help other communities replicate Project Access. There are already 20 of those in place. Congressman Charles Taylor secured a federal earmark appropriation to help get that organization underway.
Well, in the video there, we saw some of the awards you've gotten, and the program is award-winning, and you say it is spreading across the nation now. How many communities are trying to replicate this?
We are working with about 70 communities right now who are working to replicate Project Access. We have 20 communities that already have these systems in place seeing patients.
Amazing. And how, obviously, the benefit is that low-income folks can get the help they need, but there's also a cost benefit as well, you're explaining.
There sure is. As we can imagine, as a patient population improves its health, it costs less in terms of the health care that we have to provide to keep them well. So we've been able to reduce the cost of charity care, improve the health of this patient population, which then makes them better at work.
That's fantastic. Tell me also who all is involved in. It's not just doctors, but hospitals, and they can even get prescription drugs this way.
Yes, as I mentioned, the county commissioners fund the medications, but we have every pharmacy in town provides medications to these patients at their cost, and we reimburse them for the cost of the medicine with the funding provided by the county. We also have an array of clinics in town, the Buncombe County Health Center, the Doctors Free Clinic run by ABCCM, and a few others that provide medical care homes to help patients get the care they need.
So bottom line, if people need help in our area, they're watching this and they want to be able to see a physician, how should they go about doing this?
Well, the first stop is to contact a neighborhood clinic like the Buncombe County Health Center or the Minnie Jones Clinic or Ridgelawn or the free clinic at ABCCM and go by and set up an appointment there for primary care.
Fantastic. And if you'd like more information about Project Access, you can call the number there on your screen. That's 828-274-9820. Again, that number's 274-9820. And that number is for people maybe in other communities who are interested in starting this, perhaps in their community.
Correct. Thank you.
All right. Thanks so much for being with us this morning, Alan. Kathy, back to you.
What an amazing idea, and it would save a lot of other communities the investment and the research of trying to start that themselves when they can just copy a successful model. Way to go. That's terrific to have that in our area.